BIMStorm at a Distance, in partnership with the Asset Leadership Network and the National Institute of Building Sciences. Welcome to today's webinar. The formula today is we have a pandemic that is global and around the world, and we can use GIS to find information. Healthcare and people require PPE and assets, and facilities and BIM can support all this by tying the information to location and facilities. Welcome to BIMStorm at a Distance. Participants in previous webinars for this series have included the Asset Leadership Network, National Institute of Building Sciences, and owners such as the University Health System, Texas A&M, and others. Today we have Grant Thornton, Onuma, Inc., and we're using many industry open standards such as ISO, Building Smart, and other standards. With us today, we have Roger Grant of the National Institute of Building Sciences, Michael Bordenaro of the Asset Leadership Network, Arthur Kurland of the University Health System, and myself, Kimon Onuma, Onuma Inc.
Hi, this is Mike Bordenaro from the Asset Leadership Network. Very proud to be co-hosting this along with the National Institute of Building Sciences and Onuma Inc. What we're doing is showing how to use web services and web processes that have been proven over years in our business processes. But I'd like to introduce Roger Grant from the National Institute of Building Sciences, which had an excellent webinar today. And Roger, will you talk a little bit about the difference between what you did earlier today and how this interactive workshop webinar series is in your mind?
Sure, Mike. Hello, everyone. The National Institute of Building Sciences is pleased to be a co-sponsor along with Asset Leadership Network and Onuma. NIB's mission is to work with the government and with the private sector to address a whole range of different challenges around how buildings and infrastructure provide safe, secure, and high-performing environments for the people that use them, for the citizens of the United States. We're pleased to be involved in this session, which is looking at how can we collaboratively use information and technologies together to address problems. And we all know we have unique problems right now that we need to address, and we're really excited about the collaborative way we can come together to help address those problems and get people using what's available out there to come up with solutions. So we have worked with Onuma helping federal government agencies identify how to use information as an asset and make things available to be used and find things that are available and use them. And that's the theme of what's going on here in these webinars that Kimon has put together. And the webinars are summarizing the working sessions that are going on at the same time. So that's what we're going to hear about today, is some of that work.
Roger, thanks for that intro and overview. Thank you to Grant Thornton for being here today to present to us what they are doing, some really exciting work. Kevin, Richard, and Moshe will be speaking later, so we'd like to welcome them. And we have kind of an overview. We've been using this slide to present the idea that we're looking at the entire life cycle of facilities, and there's been a lot other webinars that have been recorded and posted, so I encourage those that are listening today, if they haven't seen the previous webinars, to see the short presentations that give you a background of how we got to this point. We have Arthur Kurland from University Health System with us here today as well as CHOC, Children's Hospital of Orange County. And let's just get right on with it. So real quickly, we were looking at COVID responses, and there are companies out there that are building solutions, really unique solutions on how do you build these rapid response kind of facilities. For Jupe, for example, has a healthcare module that you can load on a truck and move around the country and set them up really quickly. They're kind of fancy tents, but with all the systems in place to support healthcare. And there's another open source project from Italy that's really interesting. That was Curapods, and they're actually building these now. They're built inside containers, and these seemed interesting to us too. So we were able to get online and actually build up modules of these in BIM, and using a process that was developed at NIBS for the Department of Veterans Affairs on how do you define requirements and then rapidly build up a plan for a hospital. And one idea was, can we even stack these units? We're not even sure how high up we can go, but we tried it out. We used the prototypical layout that was posted from Curapods and built a BIM out of that. And then Arthur Curlin from University Health suggested we land this on a facility that they have in San Antonio. So we did a quick layout in one of the workshops, got to this point, and said, okay, what do we think about this? Does this even make sense? So the design is not complete, and that's the idea behind BIMStorm, is to get to rapid interaction and getting input from participants and say, well, we need a helicopter pad here, for example, Arthur mentioned. And after we finished one of these workshops, we said, okay, now we have this initial layout, we can move it to other locations. And Arthur, you had a comment at one point that we should start even tracking patient counts and staffing inside the facility so we can project over time how is the supply meeting the demand. I don't know if you'd like to say a few words about that, but that was one of your comments at the workshop. Arthur, if you're on, would you like to say something about that?
Yes, just at a high level, we were really discussing the real property and the personal property, but we weren't discussing the effects on the human asset. So that was what was prompted the question.
Yeah, perfect. Yeah, and that's actually interesting because it ties into what Grant Thornton's going to be talking about next. Is if you have the human factor in it, how many patients do you have, for example, directly starts impacting how many beds do you have, how many PPEs do you have, do we have enough to support this activity? And that's why I thought this was an interesting tie-in to what Grant Thornton's going to be talking about. So everything is interconnected. As an architect, we're typically thinking about facilities and design, all important things, but there's also the logistical part of how do we actually run this and make it work. Another part that we talked about in one of the workshops was the cost. So as we were building up these BIMs, we were starting to generate very rough initial cost. It wasn't anything down to the last detail, but using the numbers that came from Curapods as far as how much does each container cost to actually construct these. And another comment that I believe, Art, you brought up too, and others were talking about, was what if we look at this from a rent or lease perspective instead of construct, especially since these would not be needed. We would need to decommission them after 6 months or 9 months or when the need is no longer there and move them to another location, like we actually used Washington, D.C. So we said, okay, what do we look at like that? So as we start building up these BIMs, we can actually start getting other experts in that do cost estimating, for example, and use GIS, for example, to start saying, where else can we put these facilities? So we started setting up scenarios during the workshop. Very quick. This was just like 30-minute, one hour type exercise of let's move from San Antonio, now pack them up and move them to Washington, D.C. if the demand, if you look at the demand curves that were on the Esri site, actually, that showed how many patient and ICU counts do we need in different parts of the country. And obviously, we're all in the middle of all this right now. It's happening right now, but we're also planning for the future. How do we create connections between different parts of the industry to be able to rapidly respond and say, okay, now what if we move them to the Children's Hospital in Orange County? So we took the exact same layouts. We took a few floors off and said, well, maybe you only need 4 or 5 floors of these units. This might not even work from an engineering perspective. We still need input from that. But we landed them on this random site that we saw open in the Children's Hospital in Orange County. And Ryan and Tiffany, I believe you're on. What do you think of this site? This happened last night, actually.
Right. You sent it to me, and I started acting as if I was one of the planners for the hospital, and noticed I know this site. It's far away from the front door, so suggested another location and something that a little more accessible to some of the central services. And there's actually 2 hospitals here, St. Joe's and Chalk. So I outlined 1, 2, 3, 4 places other than the one with the X. So I think you came up with something, Kimon.
Yeah, we're going to show it later. We're going to do a little bit more work while Grant Thornton's presenting.
Okay.
But yeah, this is interesting from a location perspective. We quickly just landed it here. So the geospatial location using Google Earth here in this case, and then you hand sketched over it a perfect BIM, a building information model location, which is actually a good example. It doesn't always have to look pretty as long as we can communicate this is where we want to go. So the next part of this will be to let's see if we can land it in these new locations. Would they make any more sense? So leading into Grant Thornton now, I think what's interesting about this scenario, if you look at a hospital complex like this, there's obviously the need for facilities, but there's also the need for PPEs in a COVID response scenario. And imagine all the hospitals around the country and the world. So I'd like Grant Thornton to present to us what they do and how they would respond to something like this. This is an interesting angle to the BIMStorm now. Welcome. Thanks for joining us.
Yeah, thank you. Thank you so much, Kimon. My name is Moshe Nelson. I'm the Asset Management Solution Lead for Grant Thornton Public Sector. I'm just going to talk for a few seconds about Grant Thornton globally in the United States, and then we're going to jump right into our experience, particularly with this area. I'm joined with our director with our digital transformation and management service line, who oversees resource optimization, as well as a subject matter expert, and they'll be speaking a little bit later. Grant Thornton globally is, north of around 50,000 people. We're over 130 countries. We're a full-service accounting, advisory, and audit firm with significant expertise in multiple areas. And asset management is one in particular that we'll speak about today. Next slide. So just a little bit of statistics within the United States. We are in most major cities throughout the United States, around 57 offices, around actually north of 7,000 individuals. For those that are joining from the federal government, the Beltway area, we have around 1,000 public sector advisory consultants within the Beltway, as well as located in major metropolitan cities, big presence in California, as well as San Antonio and Florida. Next slide. So I wanted to take a moment to speak about some of the challenges we're seeing with clients in the public and private sector when it comes to this COVID-19 response. We've been lucky enough to be called upon to help both public and private sector, organizations battle the pandemic from an entire supply chain and resource management perspective. So what we've done is gleaned a few, overarching challenges and developed solutions that address these challenges, and you're going to see them very shortly. A few challenges for PPE is the inability, since it's a consumable, to, in many cases, track inventory, manage the data in a standardized fashion across multiple organizations, whether that's state specific or the United States, or even within one company, as well as different processes and skill sets and facility storage that exist, within a specific organization's environment. There's just significant differentiation, and when COVID-19 spun up, we saw all of this compound. So what happens as a result of this is the inability to analyze, resource, and plan very rapidly to address spikes and changes in demand and need. What you'll see in just a moment are many of the tools that we've developed to help manage this entire life cycle to ensure that hospitals, government agencies, and organizations can manage, predict, and allocate resources effectively to address the COVID-19 challenge. Next slide. So just very quickly, you'll see there's three different tools that we have here, one specific to the inventory, collection and management, and allocation of these assets. And what we'll be speaking about in depth is this network optimization. So at this point, my colleague Richard McCormack is going to bring up one of the tools that we have for inventory tracking.
Okay, so we'll switch over to Richard.
During the switch, this is Mike Bordenau. I'd just like to point out that Grant Thornton and Onuma are members of the Asset Leadership Network, and we appreciate their collaboration in bringing this presentation forward.
Okay, Richard, we see your screen. Thank you.
Perfect. So I'll provide the talking points very quickly on this while Richard drives. So this specific tool is looking at the inventory management and prediction of PPE. You'll see, 3 notional areas of San Antonio, Children's National Medical, and DC, as well as another location. We geographically differentiate this across the United States and are able to show, what the quantity levels are at hand, what is needed in the future, and then how the procurement may be managed for PPE, whether it's through contracts or purchase agreements. What this does is enable, better analytics and planning for budgeting, future demand forecasting, and the like. The next dashboard that we'll show here quickly is just weekly trends for the particular 6 PPE items in this case, so that by location you can start to see what the burn rate may be to be able to better predict budget allocation needs, future changes, and oversight from the organization's specific activities. A small note on the bottom are reporting regions, which is fairly important for many large organizations where there's differentiation in ability to collect and report data, ultimately to use for analysis. So we actually have enabled clients to track this and then follow up to ensure that you have a comprehensive picture. I'm now going to turn it entirely over to Richard to walk us through the optimization piece that helps with allocating in different facilities.
All right, thanks, Moshe, and good afternoon, everyone. My name is Rich McCormack. I'm a manager in the resource optimization group at Grant Thornton. We developed an optimization tool to support decision making around critical asset allocation. The concept of this really applies to any limited resource, from PPE to ventilators, hospital beds, even human resources, across a network of systems, entities across a network. The example that I'm going to run through today is ventilator allocation and redistribution across a hospital system. The concept being, right, that an entity in a system is going to have a starting inventory of a resource, in this case, invasive ventilators. However, there is a curve. Healthcare modeling provides those curves. They were alluded to earlier in the presentation. And those curves are unique to each location. And these are done by healthcare modeling organizations that help provide decision support. And this is one way that you can utilize the outputs of those modeling efforts. As we move up that demand curve, we know that we need to add inventory to the system. And after we've reached our peak, we know that we may have surplus units, especially and obviously for these reusable materials, human resources, ventilators, hospital beds, that can be redistributed across a network of locations. And those peaks will hit each other at different times. And through redistribution and optimization of that, you can reduce the total resource needs of the entire network. This tool ingests those curves, as well as what Moshe just walked through. What is our inventory information? What does our procurement look like? How are we tracking against our demand? We're going to be pulling all of that information in and looking at an optimization against all of that information and all of the entities in that network. So the example, and I'll zoom in just a bit here, is across the Children's Hospital network. We have a bunch of different hospitals. They have a starting inventory, an on-hand inventory of ventilators or of other resources. And based on the curves, we know by day, and in this case, we're looking at about 125 days, we know a ventilator need. These are all demo data fields, so don't read too far into all of the numbers here. but by day we know the resource needs. Because of that, we know as we move past a peak what can be released from entities within the network, as well as what's being procured, and when we're expecting to receive shipments from external sources that can be entered into this system and allocated. What we're doing here is we're doing calculations. We're putting in place priority scoring to identify the areas of greatest need. So in this case, and this is just kind of a manual example of the automated tool, we have 30 units coming in from external sources. 510 are able to be released on this day from other entities in the system that have passed their peak. And we're looking to say, where should those be allocated and redistributed to best and equitably meet the demand across the system? In this case, it's the Phoenix Children's Hospital. They only have, apologize, I'll go back one there. They only have 36 on hand on this day, and they need 95. So they only have 37.9% of what they need. That's the lowest across this demo set. And so they're going to be identified as being the area of greatest need. And so as this tool runs, and again, this is the manual version of an automated process, we're going to allocate one to Phoenix Children's Hospital. Once they receive that one on this day, their percent or their priority score is now no longer the lowest. It's actually fallen to the Nationwide Children's Hospital, and so they'll get the next one. And as you allocate this, we're going to be allocating those 540 that were available on this day. You can see how these scores and metrics and areas of greatest need will change. You can see how that's switching between the number of sites. That's obviously a manual application of this. We're going to have that automated across each day, and then across the entire simulation set of 125 days. And the goal of this, right, is to provide some actionable input and decision support around allocation and redistribution of critical assets. In this case, I've selected the Children's Hospital of Orange County. What we're looking at in this visualization is our supply and demand curves. Our supply is orange, so that's our on hand at the beginning of this simulation. Our demand is in orange, and you can see our demand is increasing. And in this case, we are unable, as we look across what's able to be released from other entities, as well as what's coming in from procurement, we're unable to match the curve at the beginning. So there's always a lot of focus on meeting the peak of a curve, but there has to be some focus on those other times where you might have exceeded your supply within the, or exceeded your supply within the system. So we are able to catch up. We do have a gap here of 140 at our max, which is an issue. However, we do make it to our peak. We're able to allocate enough for our peak time. And then as we start dropping down the curve here, we're able to redistribute some of those to areas of greatest need across that network of systems. And so, really trying to look at and use the results of this to see what are the allocation or the procurement needs, the gaps that exist, where we're going to have a gap that isn't going to be avoided, and what other mitigation things do we need to be planning for those gap periods. And then looking at a network distribution optimization as well, where we say, we understand that Children's Hospital of Orange County is going to be redistributing them. Where should those units go to reduce travel time, to reduce shipping costs, to reduce any number of factors within a network distribution. We also, and there's some visualization of those optimizations as well, as we look at where should units be sent as we move across the simulation. So that's the tool. That's the intent, right? Is to provide that optimization input, looking at those constraints to provide decision support as you look across a network of systems. Obviously, this needs to be managed by a central group. It could be headquarters. It could be a hospital association. could be a Department of Emergency Management within a state or even a federal level, to be looking across the network and helping make decisions to get materials where they're needed, when they're needed, and in the volume that they're needed.
Excellent, Kevin. That's very impressive, and it's expanded in its scope since I last saw it. So thanks for the extra work that you put into it. Is that the?
Thanks, Richard. Yeah, that was great. Okay, so let me switch back to.
While Kimon is switching back, Kevin, can you make some comments on how your clients have used this type of approach?
Yeah, I'll give some general pointers, and then Moshe has some other specific examples. But it really is a case where it's not just about the specific instance of PPE, but any kind of limited resource. And the clients that we've worked with this tool have used it in part for allocating elements of their budget, understanding how to place resources in those areas where they have the priority need, and then they use that to make decisions with respect to their budget, with respect to their operations, and how they locate the different resources. Moshe, I know you have a specific example as well in terms of the inventory piece of this that you might want to share.
Sure. Yeah. I mean, this capability is live in a few different entities and government, and is being utilized to quickly manage during the crisis, to reallocate resources, to plan for procurement, to inform decision making and readiness for different agencies. So it's real time and designed for the constraints that exist right now with the COVID-19 environment.
Yeah, if
And
anything,
just one last thing I'd point out is that the effort to get the tool up and running is not excessive. The configuration time typically can be in a matter of days, as long as you figure out what the information is that needs to go into it. So, and there.
Very important point, actually, and very interesting point at this. Imagine if this was happening 10, 15 years ago, these tools would have been very difficult to get to and build. But the fact that there's a lot of features that are easily implemented like that, and being able to do it real time also. I mean, with COVID now and the pandemic, we're also used to seeing real time data about how's it spreading and all that. But if you attach that real time, how's it spreading, to how much space do we need and how many assets do we need and how many PPEs do we need, all of a sudden having that at your fingertips is what is really driving the success of all this. So thank you for that very interesting perspective. And we'll have a discussion following the finishing of this presentation. So where we left off before you guys started is Tiffany and Ryan, you were talking about these new locations. So we went offline, and as Grant Thornton was presenting, we started to actually move things around. We moved the building from the first location that didn't make sense. Just a little perspective here, this is live on the web. It's a BIM. It can be opened up in Revit and SketchUp and other tools. The tools don't really matter. It's the data is all here, and it's accessible from many different angles. But the source of these layouts came from the CuraPod open source project in Italy. And then we landed them on the site, and we moved them to this new site location, Ryan, that you sketched out. It's not complete yet. I think there might be a little bit, you need to move it around a little bit more, but basically moving these blocks is a very simple exercise. In the background, we're seeing ArcGIS or Esri's server with their imagery coming through. So this is a mashup of BIM and GIS and information about these healthcare facilities. And then we landed them in Google Earth. So we have the first location in Google Earth, which I think the comment was that it's too far from the central location. So we have the first building here. In this case, it's just the blocks, but it's the same data that we saw earlier with more detail. And Google Earth and other GIS tools are great for doing rapid what-ifs in a specific location. And we moved it over to this new location here, and maybe Tiffany or Ryan, maybe you can give us some pointers here. I think it might be a little bit tight here, but maybe we reduce some of the building sizes. But this was just literally a few minute exercise that we did just from the quick input that you gave us.
Yeah, that looks like a great layout. There need to be some input about accessibility. This is the front of the hospital, but in times like this, I'm sure they could reroute some things for temporary usage and layout. So I'm not sure to comment there.
Well, and I'm being a clinician and not an architect myself, though. I'm amazed at the way that you all think, because you really touch on things that are very very important to what we're dealing. The interesting time frame that we're in right now is that people are considering these things where we wouldn't have this discussion 6 months ago. And so we do share services somewhat with St. Joseph, which is a different healthcare system there across the street. The collaborative efforts would be very important, and accessibility is absolutely important. I think we have actually several options, Ryan, where you say that it's too far away from the hospital. Infection prevention may like it isolated from the hospital. So you never know what the driver is going to be. Currently, many of the hospital systems, I triangulate between 3 right now, store their emergency supplies in shipping containers. And as we all know, even at the government level, we saw expiration and damage in that format. So being able to deploy things in a real time with, fresh supplies and use them on demand. I think even having a couple of options, depending on what the drivers are. Right now, this was largely an adult. If we see an emergence of pediatrics, it might need to be closer to the children's hospital. So that fluidity and being able to do these quick models and what if scenarios is really, really important.
Great input. Yeah, and this literally was just a few minute exercise. So imagine if we had a little bit more time, we could actually solve quite a bit more. The main driver here is that we're not reinventing the wheel. We're using these resources. These containers started from a design in Italy just a few weeks ago that they open source, so we can say what they look like, what content is inside it, what assets are inside it, how much space do you have to store PPEs, for example, is the scenario tying back to Grant Thornton. So this it's pretty exciting to see everybody come together like this. So let's move on. Okay, so we went from, oops, I'm getting some noise. Go ahead. Okay. All right, so we've landed at a new location here at Children's Hospital in Orange County. We have another potential site with a story unit. We're getting some background noise here from, if you can mute your mic if you're not speaking. Thank you. And back to the theme of being able to count information in these buildings, we have a bed count now. So if we know what the ICU requirements are, now as we're landing these buildings, we're getting initial costs, initial bed count, initial supplies and assets, and a count of every single piece of equipment coming from building information models. So we're toward the end. Should we start the discussion, Mike? And I started jotting down some key points with you while we were transitioning here, but the first key point is be ready to adjust to technical difficulties. This is all real time, and this happens a lot, and we know as with these online meetings, but it's natural. So I thank you for putting up with that. And Mike, why don't you jump in and start the discussion?
I think we do appreciate the audience and their time. So we're scheduled to end in 2 minutes, but I suggest that we go into overtime. If people have to leave, we understand that, but let's keep the discussion going and have it recorded for people who weren't able to attend.
Yeah, we'll share the recording. And Art gave us some good input on people.
Yeah, so Art, Kimona, if you could go back to the costs, because so much of this activity is driven by costs. Art, how does this visualization of multiple options help decision makers feel comfortable about cost outlays?
Well, you can look at it a couple of ways. Sometimes, too many options is not good too. I mean, if you think of it like when you go to a restaurant and you look at the menu and there's all kinds of choices, it makes it a little bit more difficult to choose. So sometimes less is more. But with that being said, as long as it's easy to interpret, like I'm seeing here, the graphs are great because it helps you visualize.
Yeah, it's great input. Yeah.
Excellent, thank you. And then to the Grant Thornton team, how are costs included in your projections, or is that a separate scenario that is explored?
They can certainly be incorporated, especially into things like the network distribution. You can add in costs for shipping, for handling, for the all of the components around procurement. Moshe, I'm sure you have some more notes on costs around that, right? But it can certainly be added as constraints into optimizations and prioritization if those are components that drive decision making.
Excellent. So for our fictional field hospital company, Tiffany, can you tell us some of the constraints or requirements that might be something we would consider for moving PPE from one location to another?
In large quantities, that's what you're talking about, like big. I mean, storage is always an issue. Most hospitals are pretty well equipped to handle supply, and you're talking about using it in real time. So I think to grant the people of Grant Thornton, if they have tracking of comings and goings and demands, the allocation of it and distribution is less of an issue compared to the procurement and actually being able to have it on hand with forecasting of when arrivals will be. So, if you're talking about a fluid, real-time back and forth with data sets, knowing what the demand is, what the supply availability is, maybe regionalizing it. I know even within this current COVID situation, many hospitals, get on a phone with local systems to try to share. So the distribution is less of an issue. I think that the touch points that the folks at Grant Thornton are really touching on is that supply and really finding the demand that's greatest is spot on.
Excellent, thank you. So,
and let me just add one more thing too, Mike. When you're in the system and you guys are talking about PPE and ventilators, I imagine there's going to be kind of tertiary things that may come with this as well, even though it's not an as-built problem. When you look at PPE as something that is usually single use and gets thrown away, this is vital, and so it does trickle up to your building spaces that you're talking about. And then we're going into kind of the reads with the details of PPE and stuff like that. But pharmacy, laboratory, testing, all of these things, this is all so vital to us. And so I'll just say to this panel, on behalf of the people that are inside the buildings, thank you so much for even having this conversation and for allowing me to be part of it. It touches my heartstrings to see your list of all those children's hospitals, because I know those people intimately, and I can't wait to share this recording with them.
Excellent. So speaking of spaces and the PPE, Ryan works for Solitube, which is a company that makes skylights, and Ryan got the company to start producing face shields. Ryan, can you talk about the size of the boxes of this and quantities of the face shields, just so we can kind of start understanding the space requirements for PPE?
Well, and it's an interesting concept too. We like, as a company, to ship out something that's fully assembled so the user can use it right away when they get it. But then that volume quadruples, if not even more, between flat packing and a face shield that's fully configured, ready to put on. And so you kind of have the, now you need some insight from the teams and the shields that we have delivered so far, because Solitude's made about 6,000 so far, along with HMC Architects doing their own as well, that they are pretty smart. They know how to put things together, and that they would rather have them easily accessible and not take up so much room. But the boxes, our current box is about 16 inches by 16 inches by 2.5 feet tall. and you only get 15 in that box, and it takes up a ton of room if you stack them that way. So as people who are delivering new face shield equipment for the first time, we're going through our own learning curve as well as a company that's never done that before. So it's interesting to see its impact on space.
Tiffany,
Great.
how many fields do people go through?
Oh, your audio is bad, Mike.
Yeah, I'm sorry, I didn't quite catch that. Did you say how many face shields do we go through?
Yeah.
Yeah, I think that's the question.
Okay. Well, the neat thing about this particular project is that Ryan came to me and actually got to spend a little bit of time with our central supply and actually get a little bit of feedback on what their needs were. And so they actually tweaked. We started with an open source BIM model that there were several out there, one from Columbia, one from Georgia Tech, and landing on the design, we had the opportunity to actually look at several different iterations before they landed on one. And Ryan had the specs of the actual plastic, which was pretty high grade compared to the large donations that the hospital was receiving from Rotary clubs and people just trying to fab up whatever they could. So this was a very high quality product. And we were very quickly able to figure out how to clean them, how to reuse them. So having the thought of that burn rate in mind. So there was a little bit of innovation going on as well, but also knowing that should they be disposed of and needed to be, it wasn't a huge loss. So they really struck a sweet in between for trying to minimize the burn rate and while giving them something that's pretty easy to get their hands on.
Great. Thank you for all that great input. Roger, I don't know if you're still on, but if you'd like to say a few words about the need for open standards for communicating, because all this wiring that we did to connect all these different pieces of data, all the way from facilities to information on the web to patient information, was made possible in many parts by having standards that drive the ability to connect.
Hi,
If you're
thanks,
not,
Colin. Yeah, I am still here. Can you hear me?
Yes, go ahead.
Yeah, thanks, Colin. Yes, I appreciate you raising that point. We're always trying to look for ways to make it so that the owners who get the benefits from the use of technology and the work of their consultants can use requirements that are openly available and standardized, so they don't have to spend as much time, energy, and effort developing their own standards. They can reference those that are available by the industry and have been developed through some kind of consensus process. There are a lot of different options out there, and you have to do research to find which ones work for you. At the National Institute of Building Sciences, we work on the national BIM standards, so the idea of that is to try to collect a lot of the BIM related standards together, and that is helpful. The other thing that's important here is that information be structured, and if the structure can be published and known, that is maybe the first step. It doesn't necessarily have to be based on a standard, but the structure has to be discoverable and it has to be usable by others. So I think there's a combination of things that work together, and working with the different people involved, the owner who has requirements and internal systems that they need to plug into, the software companies that make applications, and the practitioners who create the content. That's really important to bring all those groups together. So that's why, to me, this is very exciting to see kind of a little slice of how you can collaboratively do that in real time and talk about those kinds of challenges and how to address them.
Perfect. Yeah. And actually, one interesting point about this is that the open standards are about sharing information, but you can still be competitive. So, for example, obviously, healthcare systems do compete with each other, but there also is a wealth of information that's valuable that needs to be shared, especially in a situation like this. And that applies to the building industry and all across the board. And I think it's never more important than right now. And Moshe, I know that you've been involved a lot with the Asset Leadership Network and ISO 55000. And how can that be used to guide policy and strategy to inform decision making in this complex time? How do you think that applies right now? How can we best utilize ISO 55000?
No, absolutely. the requirements under 55,000 for data standardization, for the interlinking of strategy and metrics, so that we can better respond to significant scenario changes in the asset management system. All comes out of 55,000. It would significantly increase our capability to respond to significant events like the COVID-19 crisis. So I think it provides a nice framework that, if followed, would make us a lot more resilient as a country, whether it's in the healthcare industry or in the federal or state and local government. 100% applicability.
Perfect. Yes. I think that's a good place to actually wrap up this whole session. We covered a lot. We went over a little bit. We got a bumpy start, but I think we took off after that. We're resilient and we made up for some time, but thanks everybody for sticking around for an extra 10 minutes. And we will we'll have ongoing webinars and workshops in the following weeks. If you have any ideas or input, please let us know. I'm very, very excited. In this difficult time, it's very exciting to see everybody come together like this. So thank you very much for joining us at BIMStorm at a distance, and find out more at BIMStorm.com, and we'll be posting the videos and the material for everybody to access. Thank you to all the panelists, and we'll sign off.
Thank you, Kimon.
Thanks, Kumar.
Thank you, Mike.
Yeah, thanks everybody. Thanks, Kimon. Appreciate it.
Thanks, everybody.
Thank you.